Catastrophic bleeding is one of the main causes of death in the under 40-year-old age group, and treating bleeding quickly and effectively can save the person's life. One thing you need to do is quickly assess that the person is bleeding at a rate that could kill them and act to stop the flow. One general guide is to picture half a standard 330ml can of soft drink. This may not be a lot of volume, but if this amount of blood is present and bleeding continues, this could rapidly become life-threatening. You must act quickly to stop or slow the bleeding to save their life. Also be careful not to mask the problem. Many bleed kits contain trauma dressings, which is a very effective dressing. The problem is that these can hold up to half a litre of blood before you can see blood coming through the dressing. Think back about that can of drink. We said that half a can that continued to bleed could be life-threatening. That's about 165 millilitres. These trauma dressings can hold over 3 times this volume of blood. This is where the use of hemostatic dressings that can go on or in the wound, like wound clot, are ideal, as wound clot will form a gel-like plug to stop the bleed. When assessing bleeding, you also need to think about the flow of the blood from the body. A constant flow could indicate venous bleed where the vein has been cut. This blood is typically dark red in colour as it's heading back to the lungs to be reoxygenated. A bright red spurting cut could indicate an artery cut, as this blood is pumped with every beat of the heart. Both these bleeds, if left untreated, will result in rapid death. If the blood flow is slow or just oozing, then it may not be a life-threatening bleed, but it still needs quick attention as it may get worse. A deep cut may appear not to be bleeding much, but the blood may still be leaking inside the body, or suddenly the patient moves and a damaged artery now breaks. Assess the bleed and keep assessing it for change. When you first treat a patient who is bleeding, carry out a quick assessment and work fast to slow or stop the bleed, and think about the blood colour and the flow rate, as this information will be important to tell the emergency medical services when they arrive.